Hello everyone, this is Monica Singh. Welcome to in my presentation in the topic anemia related to the human anatomy and physiology. In this topic, I am going to cover the how the anemia is caused, type, and what is anemia, how we will diagnose the anemia, as well as their management. So let's start the anemia. Introduction. By the introduction, we will discuss that anemia is a condition in which the oxygen carrying capacity of the blood is reduced. As we know, the blood has two components, blood corpuscles and the plasma. Blood corpuscles are of RBC, WBC and platelets. In these blood corpuscles, RBC are that element which are able to carry the oxygen due to their specific surface that is biconcave. So if there is a decreased number of RBC in a blood, or there is a deformation in the particular structure, or there is a deformation in the synthesis of RBC formation, then it will lead the anemia. So we can say that anemia is a condition in which the oxygen carrying capacity of the blood is reduced. So all type of anemia are characterized by reduced number of RBC or decreased amount of hemoglobin in the blood. Why I am saying RBC? Because RBC is mainly responsible element who carry the oxygen. So anemia is directly related to the oxygen carrying capacity as well as decreased number of RBC. And in the anemia, skin become pale due to the low content of hemoglobin content, because hemoglobin is that pigment which is responsible for the red color. So anemic person have many symptoms like fast heartbeat, headache, shortness of breath, pale and yellow skin, cold hand and feet. Fast heartbeat is like due to that person have low oxygen content in the blood. Headache because they are unable to perform the particular function, so sometimes they may feel headaches. And as well as shortness of breath because the muscles are unable to carry proper amount of oxygen. So respiratory muscles are more under the causes the more force to take the oxygen or to exhale the oxygen. And due to the low content of hemoglobin in the blood, the skin is pale. So the yellow color of skin is due to the low hemoglobin content in the blood. As well as cold hand and feet is due to the low level of oxygen, because oxygen is required for the formation of ATP. If the oxygen level is low, then ultimately we can say that the ATP level is low in the blood. So person may feel cold hand, cold feet, or sensitive towards the cold. So anemic may have low content of ATP in the blood, and they may suffer from the cold hand and feet like conditions. So these are the common symptoms of anemic person. Now, what is the reason behind the anemia? What is the cause or type of anemia? So, according to the cause, we are categorize the anemia, or we can say anemia, the cause of anemia are of three types. Number one, due to the blood loss, or due to the decreased number of red blood cell production, or due to the destruction of red blood cell. So one by one we will discuss in this slide or in this presentation. So first of all, we will discuss how the anemia is caused due to the blood loss. So due to the blood loss, it can happen, excessive blood losses can happen due to the use of some non-steroidal anti-inflammatory drugs. That is the second point. NSAIDs, as we know, non-steroidal anti-inflammatory drugs. These are the category in which very painkillers and antipyretics and anti-inflammatory drugs are included. Example, paracetamol, ibuprofen and diclofenac, etc. So excessive use of the NSAIDs or painkillers sometimes causes the conditions like ulcer, and that ulcer sometimes causes the bleeding, and due to the excessive bleeding person may suffer in future anemia like condition due to the excessive blood loss. So the some gastrointestinal conditions like ulcer, hemorrhoid or gastric inflammation, that is gastritis. So gastric inflammation is called gastritis. Gastric means stomach and itis means inflammation. So the gastric inflammation, gastric ulcer due to the use of medicine, unnecessary use of medicine sometimes causes the anemia. So the OTC in the way we can say that we never use the medicine, especially painkiller, antibiotic and anti-inflammatory non-steroidal drugs always use the by the recommendation of the doctor. Third point which is responsible for the anemia is heavy menstrual cycle. Especially females are suffered from this, and due to the heavy menstrual cycle sometimes blood is lost excessively and it may causes the anemia. As well as post-operative trauma or post-operative surgery is also the reason of excessive blood loss. So these are the main basic reason behind the excessive blood loss and related anemia, that is gastrointestinal disease, kuch inflammation, some hemorrhoids, ulcer, and the reason of that kind of conditions is the use of NSAIDs, excessive use of NSAIDs or unnecessary use of NSAIDs as we can say, and heavy menstrual cycle as well as post-operative trauma and surgery. So first is the reason of anemia is excessive blood loss. Now the second one, the reason of the anemia is the decreased number of RBC production. The condition is normal, there is no excessive blood loss and that type condition, but RBC are produced in a less number. So the reason of that condition is, we can say that if the proper mineral or we can say essential element is not present in our body, then the proper amount of RBC will not produce. So due to the decreased number of RBC, obviously RBC production is low, then oxygen carrying capacity of the blood is also low and it will causes the anemia. The condition related with this type of anemia is number one, bone marrow and stem cell problem. I think if the person is produce less number of RBC, then it means there is some problem in the bone marrow or in the stem cell, as we discussed in the later slides. Number two, iron deficiency anemia. Third is sickle cell anemia. Fourth one is iron deficiency anemia, especially vitamin B12 or folic acid or folate deficiency. Then we will discuss one by one. First of all, we will discuss bone marrow and stem cell problem. We know that red bone marrow is a site where the blood corpuscles are synthesized, where the erythropoiesis, that is production of red blood cells, is occur through the stem cell. So if there is a problem in your bone marrow, then there is a proper amount of RBC will not formed, and decreased number of RBC is will produce, and this condition is called aplastic anemia. So this condition happen due to the destruction of the red bone marrow, and the reason of the red bone marrow is some radiation, chemotherapy due to the against some rare disease, some infection or some medication. So these conditions sometimes destroy the red bone marrow, and that marrow will unable to produce the proper amount of RBC, and that decreased RBC may lead the anemia, and that type of anemia is called aplastic anemia. Second reason behind the decreased production of RBC is iron deficiency anemia. This is a very common type of anemia. In this type of anemia, actually the synthesis of RBC require some elements like iron, folic acid, vitamin B12 and the erythropoietin hormone. Out of these elements, if the iron is deficient, then the proper number of RBC will not form, because the hemoglobin is the main component of the red blood cell, is the main element which wants the iron. So iron deficiency anemia can be caused by due to the low intake of iron in the diet, or pregnancy, or breastfeeding, or sometime ulceration. If we as the many times doctor is advised that we have to take the iron supplements or iron rich food elements, so because this is the main component of your hemoglobin and it is required for the proper synthesis of RBC, that's why if the iron deficiency is occur, then obviously it may causes the anemia, especially in the female. And pregnancy is a condition where the more blood and the more hemoglobin is required than the precursor molecule, not a precursor molecule, we can say essential element of the blood is required, that is iron. So pregnancy is the condition which may suffer from the anemia due to the deficiency of iron. So in the pregnancy, person may suffer from the iron deficiency anemia, because this is a condition where the high high amount of iron is required always. Now the breastfeeding, obviously, and ulceration, in which the excess blood is lost and the person is in a compromised condition, and we require the frequent synthesis of RBC. So for the synthesis of RBC we require the iron. So iron deficiency is always present in that type of condition. So this kind of anemia is always due to the deficiency of iron, and this is very common, and always this will produce the low amount of hemoglobin in your blood. And the third one is sickle cell anemia. This is a genetical disorder in which the RBC is formed, but they are a different structure. They are of different structure, like rod shape, sickle shape, and they are rounded. Okay. And anemia results when the red blood cells break quickly. That type of RBC is not survive for a long time, that is 120 days. They are broken down very quickly, and they are not able to produce the proper amount to the organs. Before that they will destroy. So due to their deficient improper shape. So person with sickle cell anemia always may suffer from joint pain, breathlessness, and rapid heartbeat. And that type of condition, that is sickle cell anemia, is always genetics, because this type of problematic gene is present in the person's blood. So they are unable to form the proper shape RBC, like biconcave shape RBC. The RBC are deficient in structure, they are sickle shaped, and they are not of use. And the third one is deficiency of vitamins. Vitamins means cyanocobalamin, that is vitamin B12. And because vitamin B12 and the folate are also essential element for the synthesis of RBC in the red bone marrow, but the deficiency of vitamin B12 is divided into two types. If the person is taking the low amount of vitamin B12 and the folic acid, or both, the abnormal type of RBC in a large size will form, that is called megaloblast, and the related anemia is called megaloblastic anemia. So due to the low intake of vitamin B12, the abnormal shape RBC, that is large in number, may causes the megaloblastic anemia. So this is also a vitamin deficiency anemia. And the second type of anemia which is related to the deficiency of vitamin B12 is pernicious anemia, in which there is a proper intake of vitamin B12, but there is an element in our gastric parietal cell called intrinsic factor. This factor is required for the proper absorption of vitamin B12 from the stomach. If the person may suffer from that condition in which the proper amount of there is no properly present the intrinsic factor, or the gastric parietal is unable to produce such intrinsic factor in the stomach, then the proper amount of vitamin B12 is not absorbed through the GIT tract, and ultimately the vitamin B12 deficiency will occur, and this type of anemia is called pernicious anemia. So Due to the vitamin deficiency anemia, there is a two type of anemia. Number one, megaloblastic anemia, and number two, pernicious anemia. Megaloblastic anemia is related to the low intake of vitamin B12, as we discussed in the earlier slide, and pernicious anemia is related to the less absorption of vitamin B12 due to the improper production of intrinsic factor. Now, the third type of anemia, which is called due to the destruction of red blood cells. Sometimes red blood cells are formed in a proper amount. There is no blood loss in a human body, but that type of RBC are fragile, weak, and burst before showing the proper function. And in this condition, they causes the hemolytic anemia. So when the RBC are fragile or burst before showing their proper function, then person may suffer also the anemia. Person might, that condition is present due to the some birth defect, or this condition is from the birth time, and the various reasons behind the hemolytic anemia is like infection in the human body, tumor, some kind of tumor, or autoimmune disorder. Some immunogenic cell may destroy the RBC before they are showing the normal function, and due to this autoimmune disorder, then the hemolytic type of anemia is called, and the RBC are destroyed from before the 120 days. As well as some medication like quinidine, chlorpromazine, and some antibiotics like penicillin, ampicillin, and other fluoroquinolone derivatives. So these are the condition which causes the hemolytic anemia, and person may suffer this type of anemia in any part of, in any age, and but sometime person have some type of genes that their RBCs destroy before the 120 days, and this is sometimes congenital also, that deficient RBC is present, which is fragile or weak, and they are not carry the oxygen in proper amount, so they are burst before 120 days, and but due to some severe infection or sometime tumor, this condition may also be occur in the body. So these three types are the category, or we can say the anemia is categorized basically in three major category, and how the second type is, second slide is how we diagnose the anemia. हम कैसे पता करेंगे कि एनीमिया जो है वो आपका आरबीसी के प्रॉपरली टूटने से, इम्प्रॉपरली बनने से हो रहा है, या जल्दी टूटने से हो रहा है, या हमारी बोन मैरो में कोई प्रॉब्लम है. देन देयर इज अ वेरियस मेथड टू डायग्नोज द एनीमिया, लाइक complete blood count, that is CBC. By the complete blood count we can measure the hemoglobin in our body. Second is hematocrit level, by which we comparing the volume of RBC with the total volume of blood. From the total volume of blood we can analyze the how much amount of RBC is present, that is by measuring the hematocrit level we diagnose the anemia. We can find out that the RBC level is low, or RBC is destroyed before the time, और improper RBC का जो formation है वो due to the iron है या other reason, but hematocrit level we only find the number, RBC number is proper or not, this can is find out with the help of hematocrit level by measuring the proper volume of RBC by comparing the total volume, overall volume of your blood. Then by measuring the hemoglobin level as well as by counting the RBC through the new birth chamber, that is RBC count. So these are the some primary or preliminary basic diagnostic method by which can analyze the level of hemoglobin or level of RBC in a human blood. Next is the treatment part. What is the treatment for the anemia? So treatment of anemia can be done according to the disease, according to the type of anemia. If the person may suffer from the iron deficiency anemia, then according to the requirement we have to give the iron supplement so that this deficiency is overcome. So by the dietary intake or the medicine which is rich with the iron supplements, then we can overcome this deficiency. So in the iron deficiency anemia, doctors always prescribe the iron supplement and advise that they have to take the more dietary supplement which is rich with the iron. So the next one is vitamin deficiency anemia, in which we have to take the dietary supplement which are enriched with the vitamin B12 or the folic acid. So vitamin deficiency anemia can be treated with the help of dietary supplements like vitamin B12 rich food. And the third one is aplastic anemia, which is occurred due to the destruction of the red bone marrow. So the blood transfusion or bone marrow transplantation is the method of choice या treatment of choice for that type of condition, because in that type the RBC are improperly synthesized because there is destruction in the cell of red bone marrow, especially stem cell. Because stem cell, we know that stem cell is a pluripotent cell, it is a precursor molecule to be synthesized RBC, WBC and the platelets. So if there is a destruction, there is a problem in the red bone marrow, the person red bone marrow is unable to synthesize the proper amount of RBC. So in that type of condition, either the bone marrow is transplanted totally, or for that time being we have to give the blood transfusion technique, so that person may can survive with that condition. So in the aplastic anemia, the treatment of choice is blood transfusion as well as bone marrow transplantation. Next is sickle cell anemia. In this condition, we can provide the symptomatic relief only, because this is the genetical disorder, and this is seen in the especially in other countries and some congenital disease patient. And in this condition, oxygen therapy, painkillers, because that person have joint pain, excess joint pain, so painkiller, some intravenous fluids, antibiotics, folic acid, and sometime blood transfusion may also be given to the patient. So for the treatment of sickle cell anemia, these methods may be provided to the patient to overcome the disease symptom or to give the more benefit to the patient. And the last, for the hemolytic anemia, for the hemolytic patient, we can plan the immunocompromised drug, immunosuppressant drug, because we assume that hemolytic anemia occurred due to the destruction of your breakage, broken down of RBC, and sometimes we assume that our immunogenic cell destroy the healthy RBC due to the excessive function of our immune system. So we assume that this is an autoimmune disorder, so we can give the immunosuppressant to treat hemolytic anemia. So these are the methods to treat the anemia according to the type, according to the symptoms. So these are the points related to the anemia. Like first of all, as we discussed in the first slide, that is फिर से एक बार रिवाइज कर लेते हैं कि एनीमिया क्या है. These are brief points about the anemia. तो फर्स्ट स्लाइड में जैसे हमने देखा था कि ऑक्सीजन कैरिंग कैपेसिटी जो है ब्लड की वो कम हो जाती है, स्पेशली एनीमिया में. So the anemia is categorized या condition in which the oxygen carrying capacity of the blood is reduced, and the low oxygen carrying capacity का जो reason है behind the anemia of that type of condition is the low amount of RBC or decreased number of RBC, low amount of RBC या decreased number of RBC, both are same thing, or destruction in the production या deficiency in the production, और ड्यू टू द सम एक तरीके से हमारे लाइफस्टाइल की वजह से भी हो सकता है. एंड द सिम्टम्स बेसिकली जो इन्वॉल्व होते हैं एनीमिया में, दे आर वेरी कॉमन: फास्ट हार्ट बीट एंड पेल येलो स्किन, हेडेक, शॉर्टनेस ऑफ ब्रेथ, एज वेल एज कोल्ड हैंड एंड फीट. उसको ट्रीट करने के लिए हमें उसको सिम्टम्स को देखना पड़ेगा कि कितने टाइप का है, क्या कॉजेज हैं. तो दीज आर 3 टाइप बेसिकली, and one is due to the blood loss, and due to the number 2 due to the destruction of the red blood cell production, and third one is due to the decreased number of RBC production. तो या तो RBC का नंबर कम हो है, या फिर RBC प्रॉपर्ली नहीं बन रही है, या बन गई हैं तो बहुत जल्दी उनका लॉस हो रहा है. तो फर्स्ट हमने जैसे डिस्कस किया RBC ड्यू टू द ब्लड लॉस. ब्लड लॉस इसलिए कि प्रॉपरली RBC बन रही हैं, ठीक है, नंबर भी उनका सही है, पर वो बहुत जल्दी किसी वजह से बहुत ज्यादा एक्सेस ब्लड लॉस है, या तो कोई एक्सीडेंट हो गया है, कोई सर्जरी की वजह से, या ड्यू टू द हैवी मेंस्ट्रुअल साइकिल, या ड्यू टू द सम मेडिकेशन स्पेशली NSAIDs, और इन सब की वजह से कंडीशन क्रिएट होती है आपकी अल्सर. तो ड्यू टू द एक्सेसिव ब्लड लॉस पर्सन मे सफर फ्रॉम द एनीमिक लाइक कंडीशन. And the second one is due to the decreased red blood cell production. The reason behind the decreased red cell production is bone marrow and stem cell problem, because bone marrow is the site where the RBC are formed. And number 2, the iron deficiency anemia, and iron deficiency, because iron is the essential element for the synthesis of RBC. Number 3, sickle cell anemia due to the genetical disorder, and number 4 is the deficiency of vitamins like vitamin B12 and folic acids. Then again, the bone marrow and stem cell production is bone marrow and stem cell are sometimes create the problem due to the deficiency, or due to the destruction, due to the medication or some disease. And that type of condition is called aplastic anemia, in which the bone marrow is destroyed and they are unable to synthesize the proper RBC. And the reason, as we discussed earlier, the medication, the radiation or the chemotherapy or sometime infection destroy the red bone marrow. Then the iron deficiency anemia due to the improper intake of iron. Then sickle cell anemia, this is the genetical disorder in which the improper shape of RBC is formed and they are unable to carry the proper amount of oxygen, and that type of person may suffer from the joint pain and related symptoms. Next is iron deficiency anemia, in which the inadequate or low amount of vitamin B12 and folic acid is present in the person, and person may have two type of vitamin B12 deficiency anemia. Number 1, megaloblastic anemia, and number 2, pernicious anemia. In the megaloblastic anemia, low intake of RBC, low intake of folic acid or vitamin B12 is taken by the human being. Then pernicious anemia, there is an intrinsic factor improperly present, and this factor is required for the proper absorption of vitamin B12. Then the anemia due to the destruction of the red blood cells due to the infection, tumor and autoimmune disorder. Then the diagnosis by the hematocrit level or CBC or by RBC count, and the symptoms or treatment according to the symptoms, according to the type. And these are the references for which are using to incorporate that points. Now thank you. So I hope you can give the more benefit point for to incorporate in your notes. So thank you so much. Stay safe.